So the task is Kelly, mother of Johnson, who is 8 years old. He is obese and his BMI centile is more than 99. Mother is anxious about obesity and followed up with GP twice and referred to you. Explain the mother about obesity and answer her concerns. Childhood obesity and answer her concerns. So Dr. Satish, if you are ready, we can start.
Yeah, I'm ready. Yeah, we can start.
Okay. Start. I have time.
Okay. Okay. Good afternoon. I'm Dr. Satish, one of the doctors, and I believe you are Kate, mother of Johnson, right?
Yes, doctor, I'm Kelly.
Okay, Kelly. Okay. How can I help you? I got this letter from your GP that you are concerned for Johnson's weight. Is that right?
Yes, doctor. I have been twice to my GP, and first of all, I want to know what is BMI. He's always telling me to check a BMI or something like this. So I want to know what is BMI, what for children.
Okay. I will surely explain you all these things. So actually, BMI is something like that that we divide this weight by the height, and then we calculate the body mass index. Okay, the full form is body mass index. It's like the proportions of the weight with relation with the height. Okay, am I able to clear you, Miss?
Okay, doctor. You mean to say this is just body mass and where weight is divided by height? Am I clear? So, doctor, why it's important? Why it's important?
Yeah, that's a very nice question, Mrs. Scale. Actually, this BMI is something like it's the tool by which we can say a child is or if a person is really obese or not. Okay, because like someone can be having a more weight, but with also more like height also, then they might not be obese as like with the short and having a big more weight. Am I able to clear you?
Okay. So, doctor, what is the reason behind that? Nowadays, I'm seeing that so many children, they are getting obese, and I especially worry for my child Johnson. So, what may be the reason behind this?
Yeah, Mrs. Scale, this is like this hasn't been this obesity has been a problem these days, and there are variety of reasons that is causing it. Some with these that because of diet, even so less exposure in the surroundings, like not going out and the lifestyles, and the type of foods also can impact, because we often go for the fast foods and this packet and processed food. That might be the reason. What do you think, like in like Johnson is gaining so much of weight?
You mean to say, doctor, this is like junk foods you are telling me, like
yeah,
these are not healthy at all, or what?
Yeah, definitely. These foods are not healthy. Actually, this contains a lot of calories, and which they are not any good for the child.
So, doctor, what should I do? So, how can I help? He's 8 years old, so I cannot stop these. What should I do now?
That's the biggest problem for any kid with some more weight. Like they cannot restrict the food what they would like to take, but we can just restrict like the junk foods, like not giving these restaurant foods, and not giving the oily foods, not giving the chocolates, and we can just limit these foods. Like if we cannot totally restrict, we can just limit the intake of these foods at first, right? And
okay, so what else, doctor? Just I should restrict the food, only these things?
No, beside this, you have to take him out from the house for like exercising. Exercise in a sense like you can go for swimming, you can go for some walk, right, with him, and then that will be
Doctor,
giving, yeah.
tell me one thing. How much physical activity daily Johnson should do that will be good for him?
It's not that but still at least like some 20 30 minutes in a day, that will be enough if you are taking him out of the home. And other things like you have to restrict this mobile phones, watching mobiles and screen time. So this is also good reasons for gaining weight. Okay.
Okay, doctor. So should I contact to dietitian or what? So special diet you are telling me to avoid
Mm.
these junk food. So what should I do that?
Yeah, I
How
would
can I help,
because
doctor?
mm,
Because I'm a mother, so
mm,
I cannot restrict all these foods. And he's now
yeah,
80. He's not just a small child. So how can I
yeah.
help? I cannot restrict all these foods, and so just to let me know how can I help?
First of all, like I got to know that his BMI is more than 99 centile. So as I explained you, this BMI, if it is more than 98, is we call obesity. Above 99 is 9.6 is this is a dangerous type of obesity. So at this time, we have to talk with this dietitians even regarding this how we can go with the good foods, how we can give him good
3 minutes left. Okay.
dietary
Okay.
advice, right? And
Doctor, there is
yeah,
not any medicine. I can start medicine for him.
yeah, but there is generally we don't give medicines, and if it is the medicines which are available is not recommended in these children actually. Okay. And better we'll go with the diet first, and if not only we'll go with this. And
Doctor, you are telling me this is very much obese, Johnson. So
yeah,
it may be some risk to his health.
yeah,
So what kind of risk? Is
yeah,
there any
okay.
operation we
Yeah,
can do and to stop
yeah.
this?
Mm. You know, Kaylee, like this type of this obesity is linked with this, can be related with the early onset of diabetes, can also cause the pressure problem, hypertensions, and
Oh God,
this can
oh my
have
God,
some
doctor.
problem in
This
the school, like
so why we cannot go for operation? These days, doctors are doing operation also.
yeah, we do after like I'm not an expert to tell you on all these things. I can make arrange a meeting with our consultant, or if we have a who are expert to explain you all these things. Generally, we don't carry out as a first line. We will be talking with these foods and this dietaries lifestyles at the first line.
Okay,
Okay,
doctor.
and then only
Okay, okay.
we can
Yeah,
go up.
thank you, doctor.
Okay. Okay, Mrs. Kelly, can I summarize what we have discussed so far?
Yes, doctor. Yes, doctor.
So we discussed on the Johnson being obese, and we discussed on the BMI first, and then with the why the obesity is rising these days, and we also discuss on the mode of treatment, and as the lifestyles and exercise are the first line treatment. And we also discussed on the what can be happen if obesity is not controlled. Is that right?
Okay.
Okay.
Yes, doctor. Thank you very
Okay.
much.
I think I am able to clear you. If not, I will also arrange a meeting with my consultant, and I can give you some leaflets and this on the obesities. That will be a good read for you, and you can tick out the your further queries on next meeting. Is that okay?
Okay, doctor. Thank you very much.
Okay. Okay. Thank you.
Okay. Still time, Dr. Noor?
5 seconds. It's
Okay.
finishing now.
Okay. So I can give my feedback first.
Yeah, but I want to ask you one thing. If you are free,
Yeah.
there is one more candidate. If they can do, and then you can give the feedback at once. Is it fine?
Yeah. No problem. No problem. I have half an hour still. My duty.
Okay.
No problem.
So, Dr. Sridevi, you are here?
Yeah, I joined. Yes.
Yeah. I think you did not listen the
Okay.
scenario. You joined late, right?
Yeah. Just to join.
It was a scenario on childhood obesity. Okay.
Okay.
So it was a previous exam scenario, recent. I will just tell you and the scenario, and then you can take your time, 2 minutes, and then we will start. Okay. You're listening? Hello?
Okay.
Maybe her internet is not working.
Hello.
Because
No, I'm here. Is it clear?
Maybe she muted. Okay. Callie, mother of Johnson, who is 8 years old. He is obese and his BMI centile is more than 99. Mother is anxious about obesity, followed with GP twice, and she's referred here. Explain the mother about obesity and answer her concerns. Okay.
Okay. My voice is clear, right?
Yeah. Your voice is very
yes.
clear.
Okay.
I will just give you 2 minutes. Okay.
Okay.
Once you are ready, tell me. We can start. No problem.
Okay. So, just one question. This is just a mother. I need to, like, she has concern, right? She want to talk basically.
Yes.
Or yeah.
She has been referred by GP to you, and she want to know about obesity and other
Fine.
questions.
Okay. So we can start. Good morning.
Okay. Good morning.
I'm Dr. Sridevi, one of the child doctor here. I believe I'm talking to Mrs. Kelly, mother of Johnson.
Yes, doctor. I'm Kelly, mother of Johnson.
Yeah, nice to meet you and thank you for coming here. Today I'm here to discuss about Johnson. So before we start, do you want anyone to attend this meeting?
No, doctor. I'm alone today. You can carry on.
Okay, so I heard like you want to discuss about the concerns about the weight gain of Johnson's, right?
Yes, doctor. You are very much right. Actually, first of all, I want to know what is this BMI. I have been twice to my GP, and he was always telling to calculate BMI or something like this. So I was not getting that.
Okay, so so I will explain to you about the BMI. So BMI is basically, this is about the growth of a person, okay? And we compare the weight and height. Okay. So how much weight gain is there? Yeah. By calculating, by calculating the weight in kg, okay, and height in meter, okay. Then we have to divide the weight by height square. Means we have to multiply twice the height, yeah, and divide it.
So why,
from
doctor,
the
this is very much important? Why it's important too much?
Yeah, it is important because what happens is always the normal weight is always good for health, right, Kelly?
Yeah.
So if it is high or low, it is abnormal. Okay, and always we calculate according to the person's height.
Okay, doctor. Yeah. So, doctor, why Johnson he's too much obese? Why? What may be the reason behind this? What do you think, doctor?
Yes, Kelly. So I can see that you are worried about Johnson's weight gain. Actually, there are many reasons. okay, for this increased weight gain. So like most important thing which is common is by increasing the dietary intake, okay, not the proper diet if they are not taking, that means increase calorie intake. Second thing is if they are like no they are having sedentary lifestyle, that means if they are not doing any workouts, not going out, just sitting at home, like nowadays they are
Yeah, doctor. He's always sitting on in front of TV and he's playing games. Yeah, you are right, doctor. So,
yeah.
doctor, I'm quite worried. What may be the problems with him? He's too much obese. So, what may be the problems he can got?
Yes, yes, it's a, I know you are very much worried, and it's important question what you have asked. Okay, so these are the common what I said, and other than maybe it is because of some underlying cause. Okay, and as you asked, like what can it can cause in Johnson's case means what happens is it will increase the blood pressure. It may increase, okay, because of the weight gain.
Okay.
Second, it could have, yeah, second they can have this high this cholesterol, yeah, in the body, right?
Yeah. Okay.
Then
Okay.
also, yeah, then also what happens, they can have different problem like breathing difficulty, some children will have, okay,
Yeah,
and
doctor, he's having snoring at night. Yes, doctor, you are right. So, doctor,
yes.
what should I do now? How can I help?
Yes, so now we are all here to help you and Johnson in this. Okay, what we are going to do is, first of all, we have to make a plan for him according to his weight. So the diet, what diet he has to follow. So that will be, we are going to follow, like give a referral to the dietitian. Okay.
Okay, that's good, doctor.
Second
Yes.
thing, yeah. Second thing is we have to find out like how much activity he needs. Okay, and
Okay.
third thing is we have to reduce also the screen time. As you told, like he is always sitting at home and watching
So,
something,
doctor,
right?
yeah, you are telling me about this. So, how much physical activity actually he should do at least in daily?
What they say usually like no 45 minutes of brisk activity for at least 5 days, which is what is advised. Okay, in a week, 5 days in a week.
Okay.
Okay, yeah, and
Okay. Yes, doctor.
also we need to do some like no screening or blood test for him to see like whether it has affected anything in his body. Okay,
So, what
yeah,
test? Blood test or P test, doctor?
yeah, we are going to do some blood tests. Okay, to screen few things like I told, like no cholesterol levels, also the blood counts, also we need to do for the sugar levels. Okay, even it can affect the liver. So we will see, these all things are screening. Is it
3
not that
minutes here.
confirmatory something happened? Okay,
So, doctor,
and if,
there is no
yeah,
medicine. There is no medicine we can reduce his weight.
yeah, what you have asked is, it's a like very important question. But as you know, in children and basically with this obesity problem, first of all we have to do with the non like no medicinal support, like I told, like the diet, exercise, all these things. Okay, and medicines also available, but it can be prescribed only over the children who are more than 12 years, and that too when they are not responding to these things. Am I clear so
Okay,
far,
doctor.
Kelly?
Yes, doctor. Yeah. So, doctor, these days they are telling some operation surgeries they are doing and removing the fat, something like this. So, what do you think about that?
Yes, there are many modalities are there as the science is like no, and so many things has changed. But it is like, as you know, this is surgery is something very invasive things. Okay, so always it is better to try with the other things. If not responding, or it is affecting his other body parts, okay, and he's keep on increasing his weight, then only maybe they will consider, but not at this point of time. And this will be decided by the gland doctors, okay, later if needed.
Okay. So you will be refer me to gland doctor?
Yeah, if needed, we'll send to the gland doctor, but these are done by the surgery doctors, okay? So these things in very late thing, not now. There is no plan for doing all these things at present. First of all, as I
Okay,
told, we'll
okay.
screen the
Thank you,
screen,
doctor. Yeah.
okay? Yeah.
Yeah,
So,
thank you. Thank you.
so Kelly, can you summarize what we have discussed till now?
Yeah, you can summarize, doctor.
So we discussed about the Johnson, about his excessive weight gain, what is BMI, and how it is going to affect him in future, and
Mhm.
how we are going to work up or do the some test for him, and what all things we are planning for the referral and the treatment for the Johnson. So what I will do is I will give some leaflets and some trusted website. Okay, you can go through it, Kelly. And if you have any further questions, any queries, we can arrange another meeting. Okay.
Okay, that's great. That's great. Thank you, doctor.
Okay. Thank you.
Thank
Thank you
you.
for your time, Kelly.
Okay. First, Dr. Noor, should I talk about Dr. Satish or both at a time?
As you like, the time left was 22 seconds, okay, when you stopped.
Okay.
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 No problem.
So, Dr. Satish, uh, as we are all learning here, so please take it as positive way. Okay. First of all,
Yeah. Okay.
you have start with the introduction. You did not build any repo. You did not ask I want to wait for someone else or not, and you did not ask me any previous knowledge or why I'm here. So you did not start like addressing a woman who is coming anxious with something. Okay, the first thing, BMI, you did not tell properly about the height and square root of the sorry, weight over the divided by the square root of the height. Actually, why we are doing this was not also clear. You are just telling to check the obesity. This is not only for the obesity. You have to tell that we are checking BMI for to check the weight is in healthy proportion to your height or beyond. Okay, it's going up or down. So BMI we are not checking just for obesity. The second thing, uh, about the diet, I don't think so. You should tell about this junk food is healthy or not healthy. You don't know. Just tell about why it's happened. This is imbalance between the calories consumed and calories expended. Okay. This is not the things that we are eating outside and we are not healthy. So first off, this is between imbalance between the calories consumed and the calories expenditure. So the second, you did not tell about the unhealthy lifestyle, like more sitting in front of screen timing or using more mobiles. And there are some other causes also, but that was not my concern, like genetic or other causes. So I don't think so that even should be tell to the mother. So, and risk, when I ask you about the risk, health risk, you have told each and everything. Okay, that's good. Uh, about the lifestyle, which I have written here, you have not given me that the whole family should be involved. In the leaflet, even they have written that when you are starting any lifestyle changes in a child, so whole family will be involved. If you are going for ask him to go outside and do 20 minute or 60 minute, so he will not do. So you will have to go with him. If you want to do something restriction of the diet, or there is no restriction of diet. First of all, you have told me restriction of diet. There is no restriction of diet. Just give healthy food, and you will have to sit with him, and you will have to involve the dietitian that you have forget completely. And you should like physical activity, you have told me at least should be 20 minute or more than 20 minute. Ideal is 60 minutes 5 day a week. Okay. that is in the guideline, so which I have asked you. So healthy eating, but the whole family should make the same changes. That will help the child. Other he will not be agree with you. About the medicine, definitely you will say that you will have to involve your consultant, and this is at the age of 8 years. These medicines are not recommended. Actually, this is more than 12 years of age. And for the operation, this is not your job. You can arrange meeting with the endocrinologist and surgeon. He is the best person who will help you in this regard. But the best choice to reduce the weight is lifestyle changes. This is the first line treatment which helps too much to reduce the weight. Okay, so no need of just tell that I am not the person, or just to he's the mother, and mother should be conveyed a good message. Okay, these are for you. And Dr. Shri Devi, you have done very nicely. The first, both of you forget just a build rapport, because this is not a kind of emergency. Mother is came, or not a bad news, breaking bad news. You are just giving the information, and she is anxious. Okay, just make a rapport. How was your journey to the hospital? How are you? Like this, you can ask. You both of you did not build a rapport. Other things, BMI, you have tell me very rightly about why I need. You have told me rightly. And one more thing, just this is when I asked you this, you have told me 45 minutes physical activity daily. I don't know, 45 will be accepted even, but ideal should be 60 minutes, 5 days a week, or more than 20 minutes. And again, always say that these lifestyle changes, whenever you are going to do some changes in the life of the child, whole family should be involved in that, because it will help and boost the child to adopt these changes. Otherwise, they are not going to adopt these changes. Okay.
Yes, yes. Yeah.
From other sides, I'm okay with you have done very nicely, Dr. Sridevi.
Okay.
So, Dr. Noor, you can give no feedback. This is all my feedback, which I have written.
Okay. So for the arranging meeting will be with the endocrinologist and the surgery. This
Yeah, endocrinologist.
surgeons will do this. These bariatric surgeries are done by whom? Pediatric surgeons?
No, there is bariatric
Gas
surgeon.
gastro surgeons usually they
Yeah.
do.
One more thing, both of you forget also refer to the support group, because there are so many support group for obesity
Okay, okay.
at the end.
Yeah.
Okay.
And I want to tell Dr. Sridevi, I don't know, most of the things most of us will know. Cholesterol is a common term, but still I think better to tell the mother it can increase fat in our body, what we call it as cholesterol, like explaining her at the same time and
That will be
telling
good.
that is better, I feel. This is what I observed in you. Regarding Dr. Satish, yes, BMI, he would have explained. We all know that it is weight into height square. Even though the mother is not this, you have to tell that this is the formula we do to check the weight. Otherwise, Dr. Satish, he told about dietitian, he told about screen time. But activity, I think he forgot, like 60 minutes, 5 days a week. I know this happens in the exam, even though we would have read the things, we will forget. But Dr. Satish, you should be even more cool. I mean, you know everything, but maybe under tension you forget. This is what I want to suggest you. Take even the exam as coolly. I am doing with some of my colleagues like this. Take it in your mind like this and go. You will perform the best, like as if you are seeing a patient in the clinic. Otherwise, in under tension, even though we have knowledge, we will do mistake. This is what I felt in you. Otherwise, your level of knowledge is good. See, the basic things, previous knowledge, we all know that this is a communication station, we have to ask, but tension. We will forget only under tension. This is what I want to give you. Otherwise, mashallah, you know the things well. Okay. You told about dietitian and also about the complications when asked. You told, you used the word hypertension. Better say it can increase the BP rather than telling hypertension. And also, you told about diabetes also. For diabetes still there can be increase in the sugar levels. We have to monitor because this child is more than 99. So he has to be monitored for comorbidities, right?
Yes.
Yeah, but this is actually, we will not ask any questions to the mother. This is just conveying general message to her. I think what Dr. Adnan gave points are very good. All of us can write it down and keep it in mind for this station. That is imbalance between calories consumed and calories what we spend.
Dr. Noor, this which questions I have asked, I have searched this one. They are saying these are the questions whenever mother or someone is coming in the obesity clinic, they are asking these questions. So I have covered, this is not from my side. I have searched from the Google and from NHS, trusted websites, and I have gathered from there. So that's why I asked all these questions.
Yeah, it's good. And also the good, very good point he told was because obesity is common. Now it can come in history station, it can come in communication station. Okay, and also if you want video also sometimes can come. So lifestyle changes, if you ask the child, you should encourage the whole family to do it. This is very important point here, he said. And also about the diet also change. The whole family should be encouraged to eat the healthy diet. And the time of the exercise, that is 60 minutes, 5 days a week, or at least more than 20 minutes, right? Minimum is 20 minutes.
Yeah.
And you will involve the, for medications, yeah, more than 12 years only. Then it is not recommended at this age, but still you can arrange a meeting with the consultant for her satisfaction. For the surgery, again, as Dr. Sridevi said, you will try the non-medical management first. Then if not, you will refer her to gland doctor and the surgery doctors. That's all. And referral to support groups.
Yes.
Thank you, Dr. Adnan. Your one comment was I really
Dr. Stature, your knowledge is even better than me. I know. I have.
No, I know. It was like a surprise for me. I was
sometimes you know.
Just
sometimes Dr. Noor very rightly said. Sometimes we are we cannot do because so many stress for exam.
One your comment I really liked, that was like, don't be judgmental. I just like when I also feel later, like I just like the child is getting a lot of junk foods, that I should not be judgmental. That was my greatest mistake, I think. So I talk about the junk foods and all this. He might not be getting all these things even.
Just if you want to use the word just unhealthy food.
Unhealthy food. That is more better than any other words. Yeah. Just the imbalance between the calorie intake and calorie expenditure.
Yeah.
Okay. Thank you.
Yeah. Okay, we are done with this scenario.
In this video, I will explain how to complete a cough swab with a child. You will need 2 people to complete the cough swab. Start by washing your hands. Ensure you have 1 swab and 1 plastic spoon. The plastic spoon will be used as a tongue depressor. If your child can open their mouth and cough to command, you will not need the plastic spoon. You will use the sterile cotton-tipped swab stick to collect the sample. Open the cough swab by peeling apart the plastic at one end. One person will sit with the child on their lap facing forwards. The other will kneel in front, swab in one hand and spoon in the other. When you are both ready, the person holding the child will give the child a firm cuddle, ensuring they are securing both arms and holding the child's forehead to avoid head movement that may contaminate the swab. The person with the swab will then place the upside down spoon into the child's mouth and push down on the tongue to be able to place the swab at the back of the child's throat. If your child coughs, remove the swab immediately. If they do not cough, then rub the back of their throat with the swab and then remove it. Open the plastic tube which came with your sterile cough swab by twisting open the end of the tube. Carefully place the cotton tip into the tube and push the swab into the container until it is fully secured. Wrap the swab in the white absorbent pad so that the felt side is next to the sample. This is to ensure that nothing can leak. Place this into the larger plastic casing provided and close the plastic lid so that it is firmly sealed. Place the plastic case containing the sample into the safety bag. Peel back the self-adhesive cover and close the envelope. Ensure the bag is completely sealed. Your kit will include a form which you should complete with date and time of the sample taken where indicated. Follow the instructions on your information leaflet to return the sample to us. If you would like any more information, see our home testing webpage on the Royal Brompton and Harefield website.
Okay, this is how the cough swab is taken. They have to hold, if the child is cooperative, they can cough for you when you keep the swab inside. But if they are small children like this, you have to use the tongue depressor and try to touch the posterior pharynx. If they cough, it's fine. Otherwise, just you have to collect the sample from the posterior pharynx, as she said. This is what is the cough swab. If you want, you can go back and watch this video. This is in this Royal Brompton and Harefields Hospital. Okay. And also there is information here. So we will just go through how to perform. That's it. No need to read other things. Other things can be read. We saw the same video. The same thing is mentioned here. Wash your hands and your child's hands for at least 20 seconds before and after carrying out the cough swab. So you have to wash your hands for at least 20 seconds. Then depending on the age of your child, try some exercise to loosen any sputum before you start the cough swab test. That is, example, perform chest physiotherapy, do some exercise, or get your child to huff. Okay, how to huff, they have explained in another place. So you can use some manovers to loosen the sputum before you do it, like chest physiotherapy or some exercises, and also huffing. Next is, so the position of the child is important. It is important that your child does not touch the cough swab. If you have a young child aged up to 5 years, we recommend sitting him or her on another person's lap and ask the person to cuddle your child firmly while you carry out the cough swab, like this. It was shown in the video also. Next is, older children may be able to carry out their own cough swab test with your guidance. You can give your child a small mirror to help him or her see what they are doing. Like there is a video for adult. The same thing can be done with the children. They can carry out their own cough swab by coughing, keeping the swab in their mouth, and then they can cough. But this, what was shown was for the small child. You will see a cotton tipped cough swab stick and a plastic tube inside the test kit, like this. Undo the white top of the plastic tube and set the top to inside. Okay. Now place the tip of the swab into the back of the child's throat without touching the walls of the throat and ask the child to cough. This is in old children. You can keep the you can keep the tip of the swab in the back of the child's throat and ask him to cough. It will be in old children, but in the small children, they may not cough for you. You can use a tongue depressor or a clean plastic spoon handle on a younger child if you have practiced this with us during the clinic appointments. A tongue depressor is a small tool which is used to press down the tongue, making it easier to reach the back of the throat. If you use tongue depressor, you will need to touch the back of your child's throat with the swab gently so that he or she coughs. You will stimulate the coughing by touching the back of the throat. Okay. Once you have taken swab, put the swab stick inside the tube and press the top of the swab down firmly to make sure that it is sealed inside the tube. So all those things we saw in the picture. So here how you will do is, just for the older children, you will keep the swab inside the mouth and ask them to cough without touching the walls. But for the younger children, you will use the tongue depressor and you will touch if you use tongue depressor, you may need to touch the back of your child's throat with the swab gently so that he coughs. You will stimulate them to cough by touching with this tip the back of the throat. Okay. I don't know, the sample will be from the posterior pharynx by touching the posterior pharynx, but still they are telling if he coughs, it will be a cough swab. So any comments on this?
What is the significance?
I did not. What is the question?
My question is this: what's indication? Is taking for throat swab for means just like throat swab we are taking for streptococcal, or we have to check the gag because the patient has NG.
No, they are taking cough swab for culture and sensitivity.
Okay.
This is in cases of lobectomy, bronchiectasis. This question was asked in the case of lobectomy, but the indication of lobectomy was bronchiectasis. Okay, and how you take cough swab was the question. Do you know about cough swab and how you take cough swab was the question? You got
I can understand now, because ideally in bronchiectasis we need sputum, and before 6 years or 8 years the child cannot spit out the sputum. So maybe that's the second thing. Yeah, replay alternative for this one. They took throat swab to see the growth and organism of that one.
No, here what he is telling is, with the same swab, you will stimulate the back of the child's, means posterior pharynx to cough. This is what he is telling here. Anyways, cough is there here. In the older children, they can cough for you, but for the smaller children, they are stimulating. See what he is telling. You may need to touch the back of your child's throat with swab gently so he or she coughs. You are stimulating the cough by touching the posterior pharynx with the same swab. Okay. Maybe the organisms there, or even if some organism in cough, they may get the growth and it can guide them to culture and sensitivity. Okay. But at the same time, you will also tell the sputum sample. Maybe cough swab is also one of the options you have to tell in your investigations. Okay.
Dr. Noor, just I have a question. Is the cough swab the same for sputum culture?
No, sputum is different.
Okay.
Sputum will be, you will have the sputum, you will collect the sputum or the child will cough. This is cough swab. You will cough and that swab they will send for the lab for culture and sensitivity. Sputum, the sputum sample will be sent. Okay. I think it's here. Just a minute. See here, there is separate how to carry out sputum test on a child. Cough swab is different and sputum test is different. You got my point?
Yes.
Yeah.
That in sputum one we use gastric lavage is something separate, huh?
Yeah, when I asked last time question, I think this question, both of our candidates, they told about in the form of sputum test. Like see here, what it is told. Wash your and your child's hand same at least 20 seconds before and after carrying. Encourage your child to do some exercise to help loosen the sputum. Try long huffs, a cough, and then clearing the throat. This will help your child to gather sample in his or her mouth and spit in the pot provided. Okay, they will. This is the this is the pot provided, and they will cough and they will spit the sputum. But in the cough swab, just when they cough, the swab will be in their mouth when they cough, and you will just send it for the sample. Okay. This is the difference. Maybe for small children, they can take this gastric lavage, but here he hasn't mentioned. Here he is telling what encourage your child to do some exercise to help loosen any sputum before starting, and try some long huffs also, a cough, then clearing the throat. This will help your child to gather sample in his or her mouth and spit into the pot provided. Okay,
Dr.
maybe
Noor,
for smaller children, they may use the gastric lavage. Yes?
Yeah, sorry. I just got, it's written here, sputum is recommended specimen for routine sampling for cystic fibrosis. A cough swab should only be used if a patient cannot expectorate, as the sensitive for isolation of key pathogens such as Pseudomonas aeruginosa and Staphylococcus aureus. Sampled are culture for both routine respiratory and cystic fibrosis associated pathogens.
Where you are reading from? Where?
This is NHS Glue Share Hospital something.
Can you just share for us so that we will know what is the indication for cough swab?
Yeah, I will. Screenshot I will send you.
Yeah, no problem. But it was asked about cough swab. Do you know about cough swab? How they take cough swab like this? So just to know, I just did. But I think sputum is the best option than the cough if you have the sample, right?
But before 8 years, the child cannot spit out the sputum. How can we get?
Yeah, that is what maybe by gastric lavage is one chance. Another thing is gastric lavage, again, it's a mixture of acid, right? Acid with sputum. I don't know how accurate it will be. So I think this is what in the small children, how they take cough swab, they have shown. Like they will stimulate the posterior pharynx and they will cough and they will take the swab.
And even the gastric lavage, they are taking early morning, ideally before the awakening of the child.
Okay.
Because we are taking for tuberculosis, mostly, third world countries are, we are taking for tuberculosis. So ideally they are saying it's before awakening of the child. If he wake up and then because he during the sleep, he can swallow the sputum. And so early morning we can collect the gastric lavage and we can get the maximum sensitivity and maximum growth of the organism.
Okay, but here, like in the cough swab, they haven't mentioned separately about the small children in the sputum. I don't know why. We have to check how they.
I shared it in the group, so you can review. No problem. Thank you.
Okay.
Dr. Noor, maybe it is just a swab. No, swab means just a stick. They will take the swab, but that is the collection of the sputum. So maybe that's why not in this leaflet. Okay, but that is the method what they use, no? What Dr. Yasir is saying.
I did not get you. What you are telling?
I am telling like this is about the swab, right? What you have shown is about the cuff swab. Swab is always with a stick we will take. And collecting the sputum is like either we have to aspirate or give a lavage or after nebulization. That is what is the sputum collection in a bottle. Okay, so that's why maybe it's not there in your this leaflet.
Yeah,
it's only about the swab.
Right. This is exactly what she's saying, that when you take swab, you will take from the stick. This is in the one tube coming stick with the cotton in front. So you'll take a swab. That is swab, exactly what she said. And the another, the one you take for the culture, that you will take suction the baby, then you will take from there.
Yeah, but here actually even the swab also they are using for cultures. That is what is mentioned here. So yeah, maybe this is another method. What? Yeah.
Yeah, even swab is useful.
Yes.
So here for cystic fibrosis screen, sputum is recommended specimen for routine swab sampling. A cough swab should only be used if a patient cannot expectorate, as the sensitivity for isolation of key pathogens such as Pseudomonas and Staphylococcus aureus is considerably less than sputum. So in the cough swab, it is their isolation of Pseudomonas and Staphylococcus is less compared to sputum. So they prefer.
Recommendation is sputum. Recommendation is sputum for cystic fibrosis.
Yeah. Samples are cultured for both routine respiratory and cystic fibrosis associated pathogens. Sputum samples may be examined for mycobacteria on request. Frequency should be more than once every 2 months. But this cough swab also overall, I feel sputum will come top over the cough swab. Maybe if they are not able to collect or something, they may go for cough.
We just only to know, as you said, what is cuff test, how we are performing, what is the indication. That's okay, and I think this is sufficient for us.
Yeah, only that video is enough how to take. Maybe for the older children, they are cooperative, no problem. For the younger children, you should know that you'll use the tongue depressor and you'll stimulate the posterior pharynx for them to cough. And if they can get the sputum sample, I think it's good. If they cannot, maybe they will go for cough swab. We have to check. I don't know exactly. It's not mentioned in the leaflet I gave. They have given both cough and sputum there. Because last time we did, when we did the short stature, some of the manovers were missed, I feel. So we'll just go through the manovers, which we should not forget in any short stature case. Okay. So here, always don't forget for the measurements. You will go for the height. When you go for the height, you will always ask for upper segment and lower segment. So maybe you will check the total height, and then you will check the lower segment. Then calculate the upper segment by subtracting the lower segment from the height. It's your choice. You can either do upper segment or lower segment, any one, and subtract from the total height. So upper segment and lower segment ratio is very important to know whether it is proportionate or disproportionate short stature. Then head circumference and also weight has to be requested. Then you have to know the percentile charts where the child is in which percentile. And height velocity, you should know every year how much he is growing by looking into his past growth charts. And birth parameters, because why birth parameters are important? Can anyone tell me?
For IUGR, for
Small for
gestation.
Yeah, IUGR and small for gestational age. Yeah, they are small from the beginning. So birth parameters also you have to ask. So when you, if we cannot do all these things in the history, at least in order, when we are telling that in order to complete my examination, I would like to take detailed history about the birth parameters and also the parental centiles and the ages of puberty. All this has to be mentioned if it is a clinical case, in order to complete examination. The history, what you want to know about the growth charts of the child and height velocity and the birth parameters, the parental centiles and the puberty of the parents. All. Then when you are bringing hands and feet together, I don't know, I feel that last time the feet were not told. For the asymmetry, for the asymmetry, just don't tell bringing hands together, both bringing hands and legs together. Okay, it's very important, and you see more commonly in the Russell-Silver syndrome. And also he's telling approximation of shoulder. Here you can have some absent clavicles in cleidocranial dysostosis. So at the same time, when you bring the hands together, try to have a look on the clavicles also. Next, arms out straight to detect cubitus valgus, that is in cases of Turner's and Noonan syndrome. Normal is over 15 degrees in girls, over 10 degrees in boys. He's telling more than this is cubitus valgus, right? More than 15 degrees in girls and more than 10 degrees in boys. Okay. Then this is the next action, bringing the thumb to the shoulders. Here you will see for the proximal, this one is the proximal segment shortening, what we call it as rhizomelia. You see in the achondroplasia and hypochondroplasia. Achondroplasia is a common exam case, so don't forget this Manovrs. Okay, and also it's a common exam case with disproportionate short stature. So this is the proximal segment shortening, rhizomelia with so achondroplasia and hypochondroplasia. So middle segment shortening, and he's telling distal segment shortening. I know proximal and distal segment. Which is middle segment? I don't know. Does anyone knows? This is proximal, right? This is distal. The from elbow to wrist is distal. So which is the middle segment? I don't know what is this. We can check back. So the distal segment shortening is telling acromesomelic dysplasia. As I know, rhizomelia is the proximal shortening and this distal shortening is the mesomelia. Okay. So anyone knows about
acromelia and in between is the mesomelia.
Rhizomelia is this one from the shortened humerus, like from the shoulder to the elbow, the limb is shortened. This is rhizomelia. From elbow to the wrist, limb is shortened. This is mesomelia.
Yeah, and the acromelia.
I know. Acromelia is hand, right? Short hand,
yeah,
right?
Yeah. So rhizomelia, mesomelia, acromelia in the hand, in the arm.
Yeah, I don't know this. We have to check or just leave it. Then palms, you will see in the palms, what you will see is for the simian crease, that is in the Down syndrome, and clinodactyly also you can see in Down syndrome and Russell-Silver syndrome. Okay, this is the star. You can make it as a star for this star. Then fist, you will see the short fourth metacarpal, short fourth and fifth also. Pseudohypoparathyroidism you can see, and even in the Turner syndrome you can see. He's giving 3 syndromes here. Pseudohypoparathyroidism, Turner's, and fetal alcohol syndrome. This is the making the fist. Then bend over and touch the toes. This is very important to detect the scoliosis. Most of the cases they will have scoliosis or in spinal problems. So Noonan, Klippel-Feil, Prader-Willi, these are the examples he has given. Then to detect, you have to check for the back. Always don't forget the back while standing. So for the short neck, there can be in Noonan's and even in the Turner's and Klippel-Feil. Neb webbing in Turner's and Noonan's, low hairline in Turner, Noonan, and Klippel-Feil. So in the back, you will see for the low hairline, for the webbing of the neck, and short neck. Okay. So the maneuvers which were missed last time when we did was bringing the, along with the hands, bringing the feet together, simultaneously see for the symmetry. And I don't know whether this bending test was done or not. This was my doubt. So I thought just, there is one more test missing here. Who can tell us? There is one maneuver missing here, I feel. Anyone can tell us?
Intermalleolar distance.
No, this hands beside the thigh. How far the hand is reaching up to the upper thigh, middle thigh, lower thigh. You know that, right?
Yeah. For
Yeah.
this one, Marfan or Alexander.
Yeah, up to where the hands is missing. This is not there here. That one maneuver, you can add it in this page. If you add that, I think the maneuvers of short stature will be complete.
Dr. Noor, regarding this rhizomelia involve the shoulder and upper arm. The middle segment is mesomelia involving the legs and the forearm, and distal segments involve the fingers.
Okay.
Actually, can I repeat the approach for this short?
Sure.
Yeah, first of all, we have to take a height by him making his back of the feet touching the buttocks, and also the forehead and the back of the wall. And we have to make a line from the outer canthus to the tragus, make a straight line, and then we have to take a height. Then we allow the child to sit, and then we take the upper segment. Then we subtract the upper segment from the total height, we get the lower segment, and we can calculate the upper segment lower segment ratio by in our mind. Then, and by standing also, we can also check intermalleolar distance. Sometime the CKD can present with short stature. Then we allow him to walk to see his gait, if any any DDH or something, any. Then we allow him to come back, and then we can ask him to bend down before we see his back, any deformity, and then we allow him to touch his hands to the ground, so we can see his kyphoscoliosis and scoliosis from the side and from the back. Then we will start from the wrist. First we will see the fingers, and then we will make a clinch to make a fist to see his third and fourth metacarpal. And then we have to see the skin. Sometimes hypothyroid can present, and then we have to see the pulse. And then we go, and when also in the same way we have to do this asymmetry, to have to look the symmetry first, to make both of the stretching the arms, and ask him to make more the hands to touch each other. Then we see that asymmetry from the side. Is there any asymmetry or not? Then we first go to the hands to see the third and fourth metacarpals. Then we go feel the skin and take a pulse and compare it. And then we do this rhizomelic and mesomelic procedure to touch his upper shoulder. And then we go to the head, take a OFC, and then the eyes and mouth. We have to see his any skeletal, any dysmorphism. Then we go for neck, and then we go to the legs, and if we can found abnormalities accordingly, any pallor, jaundice, or accordingly we can modify the system, either abdomen, either respiratory, or either just CVS. Accordingly we can modify ourselves.
Yeah, depending upon, like for example, in neurofibromatosis, the child may be short and you may see the multiple skin spots, that is cafe au lait spots. Then abdominal examination, chest examination, and CNS examination becomes very important in this case. But whatever, at least palpation of abdomen for any masses, auscultation of the chest for any murmurs, and any neurological deficits. We have to comment on the extra points like this. And when you are seeing these hands beside the the up to where the thigh is, they are reaching, you can see in all the three ways, like front, side, and back, all the three. Okay. Inspection is always before you ask him to walk in the standing position. You will just inspect him from front, side, and back, and also you will ask him to walk. After walking, before making him sit on the bed, you will do this bending. You will finish this bending of the back. He should bend front and keep the hands on as far as possible. At the same time, you can see the hyperextensibility if it is there. Okay. Tell in which cases of short stature you see the hyperextensibility.
Rickets, for example.
Yeah. So even in short stature, Byton score is very important. So what you will do after asking him to walk, and you will ask him to bend down, and also ask him if how much ever far he can touch his toes or on the ground. At the same time, you can check this. Afterwards, you will make him sit and do all the and also while standing, this maneuver also is very important, bringing the hands and feet together. Then you can make him sit and examine rest of the things, no problem. So when you are seeing him from front side, when the back comes, you can do this, finish off with the back for checking for the webbing, low hairline, spine, everything. When he is standing, finish off all the standing maneuvers, like where the thigh, where the hands are reaching. Bring the hands and feet together for the asymmetry. Look from the back for the neck webbing, low hairline, and all those things. For scoliosis, to be sure, maybe you see the scoliosis, but to be sure whether it is fixed or not, you will ask him to bend. At the same time, you will see for the hyperextensibility. Suppose you think that to save the time, when you're doing the maneuvers of the hands, you can also do some of the hyperextensible maneuvers. Okay. Like for the thumb, for the little finger, and when you're going up after checking the pulse, you can look at hyperextension at the elbow also. Okay, so keep doing simultaneously to save the time. And Dr. Yasser, you are telling something about intermalleolar distance. Can you tell me about it?
Actually, sometimes this CKD patients, this either pseudo hypo, this hyperparathyroidism can present just like this one. That means it's chronic kidney disease to rule out.
Like what? Intermalleolar means from where you are.
Ideally, it is 5 centimeter. If the distance between medial malleolus of the both legs, when the child is standing, we just measure it.
Okay.
If it is more than 5 centimeter, there are suspicion of this osteo dystrophy due to CKD. This is an indirect clue for this one. There are some you can say skeletal dysplasias also, in which there is more intermalleolar distance is more.
Like this presenting with knock knees.
Yeah. You can say, yeah, knock knees also.
Okay, I got your point. Like for example, a patient with knock knee will be like this, right? Like this.
Yeah, he's
so
short, but
the distance you are talking about. Normal is
yes,
5 centimeters.
5 centimeter.
Okay. So, okay, enough for today. I just, we will keep doing some revision cases, inshallah. Okay, today, so we covered one communication scenario and cough swab and this maneuvers of short stature. Okay, any comments before we end the meeting? I think this is given in mark, right? Rhizomelia, mesomelia, and this acromelia. We can go back and check it. Okay.
Only in Wine Harris, I think so. Not in Mark. Mark, we will check.
Mark, it's given. It's given. I know that.
Rhizomelia, I read, but mesomelia, I'm not sure.
Okay.
No problem. Now we know, so we will perform.
Okay. Yeah. Okay then. Yeah. Thank you all. Allah Hafiz.